are gone.
Yes, yes.
All right, so Josephine, you really right now at the center of trying to push this agenda to be included in the formal education system. We are talking about awareness, we are talking about information. Tell me a little bit about how you plan on going about this and why you find it important.
So just to, I'll backtrack it a bit. In 2013, 20 countries, Kenya being one of them, signed a commitment, and in this commitment, it's called the Eastern and Southern African Commitment on Comprehensive Sexuality Education. And under this commitment, they were supposed to do certain things. So the commitment was signed in 2013, but they had targets to meet in 2015 and 2020. So now that 2020 has elapsed, so we were in the process of reviewing what have they done and what have they not done. And some of the things they were supposed to do was to reduce the rates of teenage pregnancy, which unfortunately we still see that it's still an issue. They were to reduce the number of new HIV infections amongst young people. But then when you look at the data, it shows that half of the new HIV infections are actually from the young people. So now that the implementation period has elapsed, we're sort of like reviewing and seeing, because there's an open slot for the countries to recommit again. So we want to push the government to recommit, the government of Kenya to recommit. And when I say the government, I mean the Ministry of Education and the Ministry of Health. Precisely the Ministry of Education, because they were the ones to actually fully implement this policy, where they were the ones to provide this information to the students in school. But then based on the few discussions we've had with the teachers and the students, they are not getting this information. When you ask, when we speak to people from the Ministry of Education, we are being told that, but they have life skills. But then when you speak to the students on life skills, they tell you, during life skills, we are being taught maths, or we are being told to go for PE. So the life skill that they're talking about that is there, it's not necessarily there. So far what we've done is we've written a demand letter. I delivered the demand letter on the 16th of September to the Ministry of Education offices. We are waiting to hear feedback from them. So basically, that is what we are doing. We are trying to push them to recommit towards this commitment. So like give them time to actually work towards achieving their targets that they did not achieve last year.
From 2013 to 2020, 2021 right now, I mean, those are so many years if you ask me. I don't know from where you sit, Kevin, what do you find as some of the gaps that probably we ought to have filled for this to be implemented? What is it that we have done wrong or right, if you choose to look at it that way?
Okay, maybe to add a little bit about what Josephine has spoken about, where we come in as a country is for the fact that we are in the East African community. And in 2013, this whole process was initiated by the United Nations. And as a country in the East African community, Kenya, we supported that process, which means this commitment is supposed to be at a higher level that we're supposed to be implementing in our country. And we haven't seen any gains. What will really show that we haven't seen these gains, it's like recently we had a very high surge of teenage pregnancies, among girls 15 to 19 years. We've had issues around consent, whereby an adolescent will really go to the parent to receive consent for them to get contraceptives. And the reality at the grassroots level, we usually say, kwa ground, is that they're having sex. That's the reality. Yeah. You cannot run away from that. We can come, and the problem usually comes in whereby we mix religion and science. This is that we need to create a distinction. And
you should know you're touching very hot buttons right now.
I know. But I'm speaking about the reality.
I want you to go on, but just warning you. I mean, this whole conversation about sexuality and the young people has really gone the wrong way with a section of the populace. First of all, before you even tell me about that background, from where you sit and put Kenya in context when you define this, I want you to define what you mean when you say comprehensive sexuality education. Many people are not very comfortable with that. What do you really mean? What are we setting ourselves up for when we are talking about comprehensive sexuality education, for those who may have missed it, to understand it?
Okay. Comprehensive in itself is a wide term. But as a SRHR champion, it means things to do like, young girls who are mothers going back to school, ensuring that they're getting education. And what you realize is that quite a huge number don't get back to school once they've delivered. We're talking about things to do with getting safe abortion. You know, we've had issues around unsafe abortion. We're losing young lives. So things like that, yeah. We're talking about teenage pregnancies. And someone else will argue, how early is early? You know, we usually have a lot of issues around terminology when you say unintended, unplanned, early, unwanted. So how early is early? But the reality is we are having early pregnancies. But you see, how can these young girls prevent themselves from getting these pregnancies? And we're not just talking about the girl child. We're also involving the boy child in this conversation. You know, things that really involve the reproductive part of a girl, of a young girl, of a young boy. Yeah. So when we talk about comprehensive, we are encompassing the whole package. You know? Yeah.
And just to add on to what she's saying, I know usually when you speak about comprehensive sexuality education, the first thing that comes to people's head is they are talking about sex, they're talking about abortion, they're talking about LGBTQ, which is not the case. Not necessarily the case. When talking about, like he mentioned, there are other aspects to it. There's the aspect of critical thinking, decision making. There's the aspect of hygiene. How do you even shower? The basics, it's there. There's also the aspect of information of in case an SGBV, sexual gender-based violence happens, what is supposed to be done? This is the reporting procedures. This is what you're supposed to do, because most of the time they don't know. So comprehensive sexuality education is just ensuring that young people have information, holistic information that will help them make informed choices. For example, if Josephine, I'm 13 and I want to have sex, but then I've been told if you have sex, these are the repercussions of having sex. I've not been told sex ni tabia mbaya, if you do it you'll go to hell. Those are two different information. The person that will tell you go to hell, definitely I want to try and see, let me see if I'll actually go to hell the way they are saying. But then if you tell them this is sex, sex is good, we are not denying you it's good, but then if you have it early, these are the repercussions. Now you see they're able to and see, okay, these are the consequences. Am I really ready to like, for example, raise a child right now? No. So it's comprehensive sexuality education is just supposed to help a young person make an informed choice about their health.
How do you break down this information though? Because when you talk about a young person, I'm assuming from as young as 10 to 24. Let's use that age bracket. You know, there are things you cannot tell a 10-year-old that you can tell a 24-year-old. I mean, how do you go about it? I believe most parents are a bit concerned about the how. It's not about educating their young people about this, but it's the how. How to start even that conversation in the living room. That's where the bone of contention is.
I think what noting is that the first aspect when you talk about comprehensive sexual education, there's something that we call age appropriate. So you ensure that there's some specific words. Even when you look at the CBC, the competency-based curriculum, they've tried to even denote, you know, in the whole program, but they're not really touching where it's supposed to be touched. They're not really speaking about the thing. So they leave children wanting to question. This, I've seen this picture, it's giving me this mirage, but what else do I, like at the end of it all, when I leave school, I really want to ask myself about this and this, you know? And that's something that we want to move away from. If it's age appropriate, to ensure that class 4 or a grade 4 child receives what they can digest with that young mind. The same a grade 12 will receive something different that they can digest with their young minds. So they're not being given the same content, but of course they cannot. There are two different minds, so they cannot digest the same thing. You know,
right.
So they're given different contents.
I want to take you back. I want to take you back to what you said earlier about science vis-a-vis religion, and I just want you to explain in basic terms how you feel this has worked, either against each other or in support of each other. Like, how do you see this whole, you know, issue playing out? Okay, when it comes to addressing issues of sexuality and reproductive health among young people, where are we missing it when comparing between science and religion?
Okay, when I was actually talking about science, I was really referring to body autonomy, you know? The reality is that young people, most of the young people reach their sexual debut at a very early age, at 10, at 12. That's why you hear even in news everywhere that a 10-year-old girl got pregnant, you know? And now when you come to religion, you'll find that some denominations are against, you know, getting things like contraceptives, using condoms, that you cannot even talk, you know, to these young people when they're having their own barazas, when they're having their own Sunday schools, you know. And you're forgetting the fact that they're already engaging in sexual activities.
That's because they believe in the doctrine that you're supposed, as a young person, you're supposed to abstain until marriage. So why talk about this? That could be the argument. I'm just saying.
Yeah, sure.
Yeah.
I think that is a very touchy discussion. I think with religion, it's different for different denominations. I can say we've worked closely with some religious leaders. We have very progressive religious leaders. We've worked closely with them in terms of issues of sexual reproductive health and rights. So I think it's just bringing religious leaders on board, and then the young people and the people working towards programming the civil society organizations just coming together and just seeing where is the common ground. Because at the end of the day, we all want the same thing. It's just that we are going about it our own ways. So based on the few religious leaders we've worked with, for them their issue is they don't even know how to start the conversation themselves. That's usually the main issue. They don't know how to start that conversation. So it's just them having that, giving them information. They'll stick to abstinence, yes. They'll tell the kids to abstain. But then for those, they're moving away from, if you're pregnant, for example, you're getting excommunicated from church, you don't engage in youth activities. No, they're moving away from that. Those that have gotten pregnant, they're bringing them on board to just show them, yes, you've gotten pregnant, but then it's not the end of life. You know, they're moving from, you got pregnant, you are not supposed to associate with these others, you will make them get pregnant. So they are moving away from that, and I think that is really, really good.
All right. We cannot talk about, sexual and reproductive health and the young people and not touch on the unfortunate surge in the teenage pregnancies. You even cited this earlier, and how young people are increasingly becoming form a bigger part of those who have been affected by HIV and AIDS. And the trends, if you look at the trends, there is nothing to write home about. What is happening from a young mind's perspective? Because what we've seen is just a blame game of parents have failed, church, that is what we've seen in the public domain. But from your world as young people, what is really happening? Why are our teenagers becoming parents so soon?
I personally feel there's a lot of misinformation. There are a lot of myths around, like you will push young people to try things that they're not ready for, maybe, and we are existing in a community whereby they're adults, they're young people. Some families even live in a one room whereby they even get to see their parents, maybe engage in sexual activities and things like that.
But come on, this was there before. Even in the then generations, I mean, single rooms existed. Let's just be candid about this. What is really happening?
I think we're looking at issue around information, So most of these young people are not getting the information that they really need, that will ensure that they're making healthy choices, And of course, we're living in a modernized society, We have TVs everywhere. They watch movies, we have issues around parental guidance and all. But you see, what happens when you're out of the house? The children will put on programs, adult programs. It's written under 16, but a young person is 12 maybe. They'll see some content that they're not supposed to see, and they'll want to experiment. That's given, But how do you prevent them from even thinking about such, So they have to be well informed. Yeah.
And just to add on that, I think yes, there were single rooms before, even during all those times. But then what was different was at the time, they had, as if I was that old. They had aunties, grandmothers. They had people to talk to them. Nowadays they don't. My grandmother is in Homa Bay County, all the way there. My mom maybe works every day. My dad the same thing. I don't have someone to talk to me. So that's why we are pushing for this information to be given at the school, because students spend most of their time in school as opposed to their parents. So that's why we are saying, even with the ESA commitment that they were signing, this information was supposed to be given at the school level, because like I mentioned, they spend most of their time in school, and it's a bit easier because we've seen it's very difficult for parents to have these conversations honestly. And as someone who received CSE, as a beneficiary of CSE, I can say it actually works. It works because we'd have people come to school. I remember we were taught about decision making, what you need to look at when you're making a decision. If you want to have sex, there's the option of we were given two. You can abstain But for those who cannot abstain, these are the options for contraceptive.
So that is what many parents are worried about, that other option, that we could be setting ourselves up for something we cannot control in the future. No wonder we are having the surge in teenage pregnancies and the HIV infection rates, that we shouldn't have that other alternative. It should be this way or the highway. They've tried the abstinence way.
And it's not working.
It's not working. It's high time. We try another thing. We need to complement the two, because we are not saying that everyone should use a contraceptive. No, there are young people who abstinence actually working really well for them, but then this other one, they're outright tell you, just me, I've tried, I cannot abstain, but staki kupata mimba, what do I do? Now you see, this one is someone who they have some level of information, so you meet them from there on, which brings back to the question that you had asked in terms of age. For example, for his son, he's 2, right? So conversion he may have with the 2-year-old is about good and bad touch. For example, if somebody touches you here that is not maybe your mom or your dad, or if it's not me or your mom, then tell us it is wrong, so that when somebody does that, they'll come and see. So now, as opposed to us, that's where we have cases of 8-year-olds who've been defiled, but then when you ask them, they say uncle alinishika juju. You know, they don't know it's wrong, because they were not told as they were growing up. So as they transition, as they get older, you give them information based on 1, what they already know, and 2, based on their ages. That is what we are saying. Interesting tip there. I believe parents who are watching are taking those tips, because starting is usually the problem. So you can actually start as young as depending on what information you're giving your child, you can still just embark on that awareness and information. Yeah, and I think it's sometimes parents, there's a way you can start the conversation. For my sister is 10. She came and asked me, Mom, like, where do babies coming from? No, that's the point. The fact that they've come to ask you where the baby is coming from, you should not lie to them. You lie, you tell them they come from the supermarket, they go ask around, they will be told they don't come from the supermarket. And then they'll see you as a parent, you lied. They don't trust and they will not come back to you again for information. All right. Because we're running out of time for this important conversation, I want us to look at the way forward. When we are talking about empowering the young people with this kind of information so that they can make better informed decisions, I want you to give me your parting shots, both of you, in terms of what are the 3 fundamental things that you feel should be included in that kind of awareness going forward. Let me start with you, Kevin.
I think personally for me, now we have programs around life skills, but they are not very rich on information around sexual and reproductive health and rights. I think these are some of the programs that should really speak about sexuality, really speak about reproductive health. And what you realize nowadays is that when you go to schools, most of the time that has been set aside for these programs, children are being taken for maybe physical exercise, they're being taught at mathematics, they're all about academics, and they're forgetting this aspect about living, aside from just being educated, I think these are some of the aspects that should be really instilled in those programs, the life skills programs.
Okay. My message is to the CS, Professor George Magoha, this is for you. Your ministry, the Ministry of Education, had signed a commitment in 2013. And we as the young people were calling on to you to kindly go ahead and resign that commitment. As you resigning that commitment will show that you care for the health and well-being of young people, and you are working towards ensuring that we have reduced levels of HIV infections among young people and teenage pregnancy. So my message is recommit to the ESA commitment.
Recommit. Thank you so much for creating time. Of course, we can only just put a comma to it. Lakini mwambie waache sherehe. There are things young people can do that also on their part to take responsibility on how they live and how they take care of themselves and their sexuality. Thank you so much for creating time. Of course, you're going to be taking a very short break. We are coming back with much more still lined up ahead. The latest in the world of sports coming up, so do stay with us.